Heart disease is one of the leading health concerns among Americans, but doctors have found a new way to identify risk before a heart attack or stroke occur. Gundersen Lutheran cardiologist Dr. Raju Ailiani is here to explain how calcium scoring works. Good morning, doctor. Thanks for getting up with us.
A very good morning to you, Amy, and your viewers. Thank you for having me on this segment to discuss this very important topic about heart health.
Yeah, and calcium scoring, can you first explain what it is?
Well, Amy, this is a CAT scan technique involving a very low-dose radiation exposure to patients, which helps us visualize calcium deposition in the heart arteries. A person with normal heart arteries should not have any calcium deposition in their arteries, and they should have a calcium score of 0. As the calcium deposition progresses, the calcium score rises, and there are certain cutoffs which help us identify who those patients are who are at high risk to have heart attacks in the near future, say in the next 5 to 10 years. Calcium deposition is a part of a process where the heart arteries accumulate cholesterol deposition in the plaques and calcium in the plaques, which have the potential for causing heart attacks, and as all of us know, some of them can be fatal.
Yeah, it sounds like a very painless test, easy for patients.
It is an extremely easy test. It does not involve any needles or injections, and as I said, the exposure to radiation is extremely low dose, and it can be accomplished in a very short period of time, in as short as 5 to 10 minutes from start to finish.
So who should have this test?
Well, Amy, up until now we have been basing our prediction based on certain clinical factors such as the person's age, gender, presence of high blood pressure, diabetes, smoking history, family history of early heart attacks, and obesity and inactive lifestyle, to classify patients into those who are at extremely low risk to have heart attacks in future, those who are at intermediate risk to have heart attacks, and those who are at extremely high risk. We've been very good at telling who the low-risk patients are and who the high-risk patients are, but it's the intermediate category which has always been a trouble, because we know at least 1/3 of the heart attacks happen in people from that category. And we know that there are actually a very high proportion of high-risk patients hiding in that category who are misclassified and undertreated, so to speak. So it is this intermediate category who benefits the most from this test, which can help us guide their management. So it's basically to predict and prevent, not just for predict and pray type of a policy. So it's the intermediate category who will benefit the most. So if people have one or more of these risk factors, such as age more than 55 in men and age more than 65 in women, high blood pressure, smoking, diabetes, obesity, inactive lifestyle, or family history of early heart attack in their family members, their family doctors may talk to them about possibility of them being candidates for this particular test to help identify their cholesterol number goals and so forth.
All right, and of course, early prevention is the key to heart disease. Dr. Ailiani, thank you so much for joining us to talk about calcium scoring. Again, it's not covered by all insurance plans, so it's best to check with your insurance provider if you're interested. Have a good day.
Thank you.
Thank you. Next.